Thank you. I want to mention two things. One, Jonathan mentioned that the adult center and the staff members are getting younger. I'm the oldest, if anyone wants to know. Hopefully I'm not the dinosaur, but I'm the oldest. The other thing I want to say about my short presentation and what I've seen here today is I lifted a lot of these slides, and I have to admit, from previous CF talks and from Michael Boyle, who's a CF Center Director at Johns Hopkins University, so I'm thanking them publicly, as well as I did some of my own. So I came home last evening and I showed them to my daughter, and I said, "What did you think about these slides?" And she said, "They're weak." So she showed me what she had produced for a class that she's doing a presentation. She had movie pictures, she had things from the internet, she had filmed herself being interviewed by herself. I mean, she did a wonderful job, and she was in 7th grade. So now I know what weak means. Wow. That was, talk about transition. I had quite a transition there. But what I want to do today, we have 3 people here who are going to be part of the panel discussion. And I'll introduce them. We have Jarrett Krause, who is someone who comes to the adult clinic. Terry Bennett is a social worker in the pediatric clinic. Patty Morris is a mother of a young lady with CF in the adult clinic. And Jackie Estes is another young adult with CF who is in our clinic. And when I'm done with my talk, it'll be about 5 or 10 minutes just to set the stage about transition, what it means, and some of the numbers related to transition, and what Dr. Carnes had said, that it's going to be really an important thing to focus on because the whole area of age is shifting. It's becoming an illness and disease for adults, not just kids anymore. So how do I do this? I know, I need my daughter here to do this. So transition. Transition is a purposeful and planned movement of adolescents and young adults with chronic physical and medical conditions from the child-centered to the adult-oriented healthcare system. And I have a really good appreciation for it working in both centers because I see how it's different. I see how adult physicians are trained and pediatric physicians are trained, and there is a difference. It's a hard thing to describe, but when a family comes into the pediatric clinic, it's a family. Sometimes 4 people come in. When an adult comes in, 1 person comes in. So we really just see that 1 person, and we don't oftentimes know as much about that person as they age as when they were younger because we have family members and parents who are there to talk. So we lose track of who the support system is for the families, and something that I think we have to try to maintain. And the goal for today is really to learn from the 3 experts that we have here because they live every day with CF. They know how it works, they know how it doesn't work, they know what works for them. And we're constantly asking them what works. We know medically, we know scientifically, we know medically what works, but we often don't know what really works for the people who are trying to do 3 times a day chest PT, meds, inhaled meds, and sometimes we just pack it on and hopefully they do it all, and we know it all can't be done at times. It's a lot of things that we ask of them. The first slide is just to show you what the median predicted survival is of CF, and 37.4 years. But I guess where I really want you to see is at the end here, 1986. I don't know what it was then. Was it 17, Anna, in the teens back in 86?
Yes.
And so in
The pediatric.
right, it was a
yes, mid-teens.
Mid-teens, okay. And now we're at 37.4 years, and that continues to climb. And you can see that from about the mid-90s, it's really taken a sharp increase in survival rate. 1996, the CF Foundation mandated that all CF centers with 40 or more patients develop an adult program by the year 2000. And nationwide, in 1996, there were 19 adult centers, and in 2010, there were 96 adult centers and 115 pediatric centers. We developed the first certified center in 1999 when Dr. Zuckerman came on board. There were 25 patients, and in 2010, there were 60-plus patients in the adult clinic. And some of that's occurred also because the adult center in Lewiston closed, and we had an influx of adult patients who came to our clinic in Portland. And the age range in our clinic is from the youngest is 19, the oldest, I think, is just over 60. The current percentage of individuals with CF in the U.S. that are 18 years and older, what do you think I don't have the fancy things that Dr. Zuckerman had. As you can tell, this is weak. I'm sorry. I apologize. So what do you think, A, B, C, or D? D? Now here's where you're going to see. Actually, it's C, 47% of individuals. If you can see that right here, I think what the interesting part of the slide is when you see this 18 or over, we're treating in the adult clinic 10, 20, 30, 40. We're going to be treating people with CF for 30 or 40 years as an adult. And the pediatric clinic gets them to about age 20, 18. So you can see that this is really becoming an illness and a condition that's going to be treated by a lot of adult providers. Not only CF, but there's going to be other issues that come along. And based on the current epidemiological trends, in this year there were more adults in the CF than children. Any idea what year that will be? 14? Correct. It will be 2012, I'm sorry, that there will be more adults than children with CF. The approximate number of individuals with CF in the U.S. between the ages of 15 to 20 that will need to be transitioned to adult care in the next 5 years. Anyone want to take a guess? What's that? 4,000. Correct. 4,000. And that number, if you'll see here, is between 15 and 20, 15 and 18. Those are the kids that we're going to be starting and families we're going to be working on, making sure that when they become that 18 and 19, that they have a good understanding what they need to do to maintain their health and be healthy. And that whole number and group of people is going to be shifting. So you're going to see over the next 10, 15 years a ton of people right in between here, young adults living with CF, and it's going to really balloon the adult clinics. I just listed some goals up there that we have for high school years, and I have some for 18 and 21, just to give you an idea of the kind of work that we're going to be doing transition-wise with kids and young adults in our clinics. Listing of medications, the times, answer questions independently, recognize changes and symptoms, be able to describe them. Are they doing their airway clearance? Do they need help? And describe choices that they make about smoking and drinking and how that affects their general health. Goals for 18-year-olds, having them speak directly to CF caregivers to discuss changes. Do they participate in scheduling, participate in refilling prescriptions, and then can they maintain their own equipment? And I think lastly, when you go into the adult clinic, can they make contact with caregivers and discuss changes, schedule appointments, refill prescriptions, and most importantly, some of the young adults are finding is details about their insurance and strategies to maintain their health insurance coverage. We just recently had some major changes, so we're all scrambling to try to find out what all of that means. So there's really one goal in transition that we really want to do. It's not perfection, not to make sure that everyone does all of their treatments every day, but to make sure that we're teaching them to be self-responsible for their own care. How is it that they can manage and live with their illness every day? And hopefully what we'll find in the next few minutes is some of the young adults here who are living with cystic fibrosis, and we can learn from them how it really works. We can help treat them, but they're the people who, I think, live with it, and they're the experts, and hopefully we'll learn from them today. So I introduced Jared, Patty, and Jackie, and Terry Bennett will help moderate questions that we have, and we'll take questions from the audience. But if Jared, you're going to be first because you're the nearest one with me, and if people, they'll give a 4 or 5 minute update of where they are with CF, how transition has gone for them from being a kid with CF going to adulthood, and then we'll entertain questions.